look at the patient, 20-year-old Mr. John comes to us with a complaint of skin lesion. So here we can see the skin lesion. So we can see the skin lesion here. Please come here. Okay. So here is the skin lesion. We can see these are all the neurofibroma here. So whenever you found a patient with neurofibroma like picture, you can check, you can tell your examiner that you should check the patient whole skin survey. So can you go back? Ulta ghure jao baba. So here we can see there is another spot, we can call it Café-au-lait spot, and another one is the big Café-au-lait spot. So we have to search, and another one is here, another Café-au-lait spot. So we have to search all over the skin for any kind of skin lesions, presence or not. Okay. Ghure jao baba. Okay. So how can this case come in your MRCP PACES exam? There are several cases come in the PACES exam. Number one, this patient can come with vision problem. So what is the cause of vision problem? Most likely optic nerve glioma or optic pathway glioma is one of the causes, important causes. And another finding in the eyes could be found that Lisch nodule. So Lisch nodule could be a possibility of vision problem in this patient. Second, this patient can come in the exam hall with a history of repeated convulsion. So what could be the cause of convulsion? If this is a patient of neurofibromatosis type 1, so there could be some intracranial tumor and there could be some cerebrovascular anomaly like Moyamoya disease can cause seizure. And if it is type 2 neurofibromatosis, the most common cause of seizure is meningioma in this patient. So through the repeated convulsion, it can come. Another problem in the PACES exam come in several centers, that is headache with tinnitus. So if this patient comes with headache and tinnitus, don't forget to check patient 8th cranial nerve, because in neurofibromatosis type 2, the first cranial nerve involved is 8th cranial nerve, and then 5 and then 7. So you have to exclude vestibular schwannoma. In neurofibromatosis type 2, bilateral vestibular schwannoma is the most common. So if the patient comes to you with the complaint of headache with tinnitus, we have to look for 5, 7, 8 cranial nerve along with cerebral signs. Another problem came recently in the exam hall is the back pain. So what is the cause of back pain? Most likely any kind of compressive myeloradiculopathy due to any kind of spinal neuroma or plexiform nerve sheath tumor. So this is the most common cause in this patient. And another thing I'd like to add, in Middle East, this case came in the exam hall with a complaint of bloody diarrhea. So what could be the cause of bloody diarrhea in such a young patient? In such a young patient, bloody diarrhea has several possibilities, but in case of this patient of neurofibromatosis, we should exclude any kind of tumor like gastrointestinal stromal tumor. Okay, so that's how this case can come in PACES exam. So you should go through your books and read all the findings, and you are able to differentiate between the type 1 and type 2 neurofibromatosis. Thank you.